Today in court, we have docket number 387758. The case is a result of the Federal Register's 2001 final rule. The final rule states that current physician supervision requirements for a certified registered nurse anesthetist have the option of exemption from this requirement, as long as the state law, governor, and the state boards of medicine and nursing all agree. This is the plaintiff, Dr. Samantha Hermida. She states that the defendant is incompetent for independent practice. She states the government needs to put a stop to the scope creep. It is not in the best interest of patients, and quality of care will greatly suffer. She is suing the defendant to cease and desist all lobbying attempts to remove supervision. This is the defendant, Dr. Danielle Chung. She states that she has been thoroughly educated and trained to practice to her full scope. She says that she does not need a babysitter to oversee her cases. She claims the plaintiff should take notes because her outcomes have been superior.
Good morning, ladies. Calling the case of the CRNA's first anesthesiologist. Are both sides ready?
Ready for the people, Your Honor.
Ready for the people, Your Honor.
Your Honor, and ladies and gentlemen of the jury, the defendant, Danielle Chung, is a CRNA and she believes that they should be allowed to practice independently. This is because CRNAs provide an essential service to surgical patients across the United States. They are primary providers of anesthesia for the military, and they give access to anesthesia services in rural and urban areas. Their diverse CRNA curriculum contributes to an excellent quality of care.
Your Honor, and ladies and gentlemen of the jury, the defendant and all CRNAs should not be allowed to practice independently. CRNAs spend less time in school than anesthesiologists. Hospitals receive financial compensation for training physician anesthesia residents, but receive no compensation for training CRNAs. The public believes anesthesia providers should be physicians. Roles of the CRNA may be confusing for the public, leading to decreased acceptance. There's not a lot of research related to CRNA quality and effectiveness when practicing independently.
The prosecution may call its first witness.
What is your title?
Certified Registered Nurse Anesthetist.
And how long did you go to school for?
I went to school for 4 years undergrad. I have 5 years of ICU experience, and I went to grad school for 3 years for a combined 12 years of education and experience.
And how long do you think your anesthesiologist went to school for?
To my knowledge, it's about the same amount of time. They go to 4 years undergrad, 4 years of medical school, 4 years of residency, and a year of a fellowship.
Do you feel CRNAs are equivalent to anesthesiologists?
Yes, I do.
Even without the same amount of schooling?
Yeah, research shows that there is no difference in the quality of anesthesia care.
But isn't it true that many states prevent CRNAs from practicing to full extent of their education and training because of this? If they're equal, why do you think this is?
I think it's a biased situation. It is true that many states still limit CRNAs from functioning to the full extent of their education and training, but the Institute of Medicine says that change is necessary to ensure access to quality care.
But were you aware that the American Society of Anesthesiologists, anesthesia is safer when provided by anesthesiologist-led care?
That's an inaccurate statement. Nurses provide holistic, patient-centered, culturally competent care that results in equivalent or superior patient outcomes.
The prosecution rests, Your Honor.
The defense may come to the stand.
And what is your title?
I'm a physician anesthesiologist.
Were you aware that there's currently a shortage of anesthesia providers in the United States?
No, but CRNAs aren't going to fix that shortage.
Wouldn't you agree that preventing CRNAs from practicing independently decreases the anesthesia services and can be dangerous?
No. Well, most patients believe anesthesia providers should be physicians, and we anesthesiologists believe we are safer anesthesia providers.
Were you aware that if states opt out of the physician's supervision, it would reduce anesthesia costs greatly? And then those funds could be relocated to other areas of patient care.
That sounds like less money for hardworking anesthesiologists.
Hospitals just want to save money, but it's not safe for the patients when they cut corners.
Well, do you know what the pay difference is between a CRNA and an anesthesiologist?
Yes, we make more money because we're physicians. We're highly trained medical specialists. We provide more and better services than CRNAs, and we have more responsibility and provide safer anesthesia.
Well, the cost to train an anesthesiologist is 6 times that of a CRNA, and then their salary is double of a CRNA. Yet time and time again, studies seem to show that the care is equivalent. Well, considering there's a shortage in anesthesia providers, wouldn't you agree that giving independence to CRNAs would improve access, especially to underserved and rural areas? And it's a cost-effective solution to this problem.
I mean, I guess that makes sense, but we anesthesiologists still believe it's not safe for CRNAs to practice independently. According to the American Society of Anesthesiologists, physician anesthesiologists should lead anesthesia care teams and delegate monitoring and appropriate tasks to nurse anesthetists. Nursing skills are important, but they cannot replace the education and training of a physician.
Well, more access to anesthesia services means that hospitals would have better wait times, more efficiency, and more access services to their patients. And isn't that what you want, to be able to provide anesthesia services to your patients? And isn't that what hospitals and everyone wants?
Those things are important, but we believe that those things can still be accomplished with physician anesthesiologists as the primary anesthesia providers.
Well, are you familiar with the Veterans Affairs hospital system?
Of course, the VA is the largest health system in the United States.
Correct. And as of April 21st, 2020, the VA decided to eliminate the physician-led model, giving CRNAs full independence. This was widely accepted and resulted in better consistency and decreased variability with CRNA practice. And it provided excellent care for veterans. Well, with all of their success, the removal of physician supervision set a new standards for hospitals that it's likely to be adopted by other systems. And with that being said, Your Honor, the defense rests.
I want to thank both parties for presenting their cases in court today. Each side presented valid points for their argument. For years, the healthcare system has run on a physician-led model. Patients were able to have access to high-quality care that rivaled many developed countries. For years, this model has worked for us. However, we need to look at the world we are in today. Cost of care has gone through the roof, and it is the job of the government and the healthcare system to find a solution. Patients are putting off procedures, ignoring ailments, and pleading for affordable healthcare services. Doctor, I understand why you would like things to remain as they are, but you have to keep the patients in mind. Keeping CRNAs below your thumb does not serve the greater good. In actuality, it exacerbates the problems within the system. Although their path to anesthesia differs from yours, it does not make them inferior. Both professionals should be able to coexist in a team environment as equals. Both of you have earned your titles. You both must not forget it is not CRNAs versus MDs. You are on the same team and have the same goal to improve patient access and quality of care. With the COVID-19 pandemic, CRNAs have stepped up to the challenge, practiced to their full potential, and have proved that they are competent practitioners. Outcomes have shown that there is no difference between the care given. With that being said, I rule in favor of the defense. I hope this verdict brings about positive change and equal access to all.
Get your money, man. Life goes on.
I'm hopeful, yes I am hopeful for today. Take this music and use it, let it take you away. And be hopeful, hopeful, and he'll make a way. I know it ain't easy, but that's okay, cause we hopeful. I'm hopeful, yes I am hopeful for today. Take this music and use it, let it take you away. And be hopeful, hopeful, and he'll make a way. I know it ain't easy, but that's okay, cause we hopeful.
I wish that you could show some love instead of